Hi, I'm Michael Zahalsky, and I've been a urologist in private practice for about 11 years now. I'm fellowship trained in male and female sexual dysfunction. Currently, I've been working on using biologics and stem cells in the field of primarily sexual dysfunction, erectile dysfunction Peyronie's disease in urology for the last 5 years. The use of biologics throughout all of medicine, or regenerative medicine, is an up-and-coming field. You see it in orthopedics, in plastic surgery, in dermatology, and in podiatry. I've always been one of these people that when you see a hole, you have to fill it with something. So when I realized that these products weren't being used in urology yet, I thought it was important to start studying them, which is exactly what I've started to do. Traditionally, when you think of stem cells, you think of cells that get implanted and start growing themselves. When you think of biologics, you think of growth factors and cytokines and interleukins that are used to actually help the penis reactivate its own cells. This is what we've been doing, and I've found that by using amniotic fluid, we've been doing this with great success. Currently, when you think about treatments for erectile dysfunction, you think of the pills such as Viagra or Cialis. This type of medicine was invented in the 1990s. There's also injectable medicines. I want to have sex right now, so I go into the bathroom, I come back out, and 2 minutes later I have an erection. And lastly, you think of putting a penile prosthesis in, an inflatable penis that goes inside of you that you pump up every time you want to use it. What we're able to do now is by injecting growth factors, amniotic fluid, into the penis, what I have been able to do is prevent people from progressing to that next treatment option. So to date, and I've been treating people for years at this point, I have never had a patient need a penile prosthesis after having been injected with my growth factors or with amniotic growth factors. Typically, patients are not progressing from oral pills to injectable medication, and that's where we're seeing the biggest benefit. There are 20 million or more men suffering from erectile dysfunction in the United States. There are over 1 million men with Peyronie's disease in the United States. My goal is to support and promote the research of using biologics for these people and for these conditions to bring erectile dysfunction and Peyronie's research to the next level of research. To do this, I've recruited some of the biggest names in the world that specialize in erectile dysfunction Peyronie's disease to help my cause, and have brought them onto my UroCellZ advisory board to help me with this research. Once this research is performed on a larger scale than my small papers, I believe that we're going to affect change throughout the world and redefine how to treat people with sexual dysfunction. Currently, there are 2 deviations of the procedure that we do. There's a procedure for erectile dysfunction where we inject amniotic fluid into both corpora cavernosum and try to keep that fluid in the corpora for as long as possible to, again, revitalize the corpora. With Peyronie's disease, we want to inject it into the both corpora as well, but we also want to make sure that we get primarily into the Peyronie's plaques where the scar tissue has concentrated itself. What my studies have shown in terms of how soon after treatment you can expect to notice change is that at 6 weeks, you notice some improvement. It's continued up to 3 months, and it even continues up to 6 months, and then levels out between 6 months and a year. Sometimes a series of injections is necessary for a patient. You never know, again, where you're starting and where you want to end up. I recommend typically 1 injection followed by another injection 4 to 6 weeks later, and if necessary, a 3rd injection even 3 months after the 2nd injection. The future of urology is exciting. Just in the few short years that I've been using these products, I'm now able to tell you exactly what's in the products and in what concentrations, and show why these products are actually helping with erectile dysfunction Peyronie's disease. That's the science side. But on the patient care side, we can take these same concepts, just like they have in orthopedics, and apply them to not just erectile dysfunction Peyronie's disease, but lots of other conditions in urology, such as urethral stricture disease, possibly incontinence, and lots of other urologic conditions.